Good morning. Happy Sunday. This is the Sunday TFCC broadcast. This week we're going to talk about the flexor pollicis longus. I'm not very happy with the extensor carpi ulnaris discussion. I think we're going to need a couple more weeks of that. But I am going to be doing videos every week, including physicians and cortisone and cupping and needling and anything related to the TFCC. So stand by. This week, though, we're going to do the flexor pollicis longus because half of all wrist fractures involve the TFCC. And I've been getting a lot of cases that have wrist fractures and ulnar-sided wrist pain. And I wanted to make this video in response to some people that have a flexor pollicis longus adhesions in the wrist that contribute to ulnar-sided wrist pain. So let's go over what the flexor pollicis longus is and what it looks like. So the flexor pollicis longus attaches to the tip of the thumb, and it's responsible for bending the tip of the thumb. It comes down, crosses the wrist. It's one of the three deep flexors of the wrist, which means it goes really close. From here, it goes through this groove and then down up into the radius and attaches here. So what that looks like is this. The muscle is here. It's deep, so it's really hard to palpate. But if you take your hand and you place it about right here and you bend the flexor pollicis longus, the tip of the thumb, you can feel, if you press hard, you can feel that muscle moving here. So if you take the wrist and you put it into full wrist extension, and then you take the elbow, put it in full wrist elbow extension, and then you take the thumb and you go into full extension, and you fire that long flexor of the thumb, and it causes ulnar-sided wrist pain, then it's really easy to, what that's essentially saying is that flexor tendon that crosses right here is probably scarred in this area. And this scarring is pulling this down and causing pain to the ulnar side of the wrist. So what you do is you take it on stretch and you stretch that back, and that glides this distally, moves this. So you go into wrist extension and thumb extension and pull this, and then you fire the muscle to pull it back this way. So the way that looks is you take your wrist, you put it on full extension, take the thumb, pull it on full extension, and then bend the thumb all the way over. You can add a wrist flexion to it to get that thumb gliding distally and then proximally. So the exercises are wrist extension, thumb extension, pull on that thumb, bend the tip of the thumb to fire that flexor, give a lot of resistance, and then pull it over in flexion. When you do this, you can put some heat on it. You can do it after a nice, good hot shower or a good exercise. And then you can also try some taping. This Kinesio tape is really wonderful. But you can tell if that muscle is moving this way, if it's moving well, by if it hurts this here, or you can tell if it's having a hard time moving this way when this is difficult. So you're not able to take that thumb and pull it all the way down into wrist flexion. So you can try a bunch of different things to see if this helps it along. You can take this and pull it over and massage it all back and forth. And then you can also tape the thumb. You can tape it a variety of different ways. You can pull it into full extension, kind of help that thumb along. Pull that back into extension. So you take a tip, tape the tip, pull this here, oop. This is one way to get that tip of the thumb to go back. You can also put this here. You can play with a variety of different ways. You can pull, attach it, try to pull that carpal tunnel scar, kind of mobilize that scar laterally, see if that helps. You can massage here to get that scar moving. But if you've had a wrist fracture of the radius or the ulna, what happens is the bone has a lot of creates a lot of scarring when you fracture a bone, and so what happens is it adheres down onto that flexor pollicis longus and can affect ulnar-sided wrist pain when you start to move that thumb. The other thing that's good to know is that right next to the flexor pollicis longus are the flexors of the fingers. And you can test this by putting your fingers back and bending this, and if it's stuck in here next to the flexor pollicis longus, that'll also be a little bit tender. All right, so send me any questions that you have right now on the flexor pollicis longus. Because it's a deep flexor, it's really difficult to get into the muscle belly in the forearm because there's a lot of things on top of it. So E-stim is really hard to generate any sort of force through that flexor pollicis longus. Deep tissue massage is hard. You can do some acupuncture here that will help that. You can do some cupping. So I'm going to bring my cupping tool next time. That can help with that scar. Deep tissue massage here. But the main thing is that you got to take that muscle tendon system, put it on stretch, and then fire the muscle. Unfortunately, it moves very quickly, and if you heat it up and you go through it, you should relieve some of that ulnar-sided wrist pain. To strengthen it, the best way to strengthen it is to put it on stretch and then just fire, 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 and go tip, 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 and then tip. You can also do them in flexion and extension. Yeah, you can add some putty or some clothespin to help pull that tendon through the carpal tunnel. Okay, let's see. Hi, Renee. Hi, Coastal Rehab. So the people with wrist fractures that the fracture location is here, this part of the bone here, or this part of the bone here. You can see how that would affect the TFCC. It's super important after the fracture, after you've been casted or treated and stabilized, that you hold these two together, because that'll keep the TFCC on slack while the bone heals. And then also you want to make sure you move your thumb and your fingers to get this gliding through that fracture site, because it'll scar down really commonly. It'll scar down here, it'll scar down all in here. So the post-op protocol for people with wrist fractures and suspicion that the TFCC is involved is to early mobilization. So you squeeze the distal radius and ulna on week 4 with the WristWidget or with tape, and you go through tendon exercises, range of motion exercises, ultrasound, all of that stuff. But you've got to support that TFCC while you go through rehab. Otherwise, when you do start to mobilize it, it's just really painful. So consider the TFCC and the flexor pollicis longus treatment protocols if you've got a wrist fracture. It's a lot easier to treat it early than it is to do it late. All right, also, I want to see if you guys have any questions or topics that you want me to cover next week. I think next week we're going to go back to the extensor carpi ulnaris and talk about needling, cupping, some E-stim, and some taping techniques. I'm going to bring back Allison Taylor, who's the Kinesio tape guru, and we're going to go over some taping techniques. I think the ECU needs a little bit more time. I think we need probably 2 or 3 weeks of discussing that. I'm not happy with what we didn't cover last week on the ECU. All right. Hi, Alley Cat. Hi. Okay. Some of the questions that I've received this week. Sorry, I just lost connection. I wanted to show you a quick way to measure grip strength if you don't have a dynamometer. All right, hold on just a second. The scale is pretty handy for a lot of things. and the knowledge is really important. So weight bearing, of course, is one way to measure stability of the wrist ligaments, but that doesn't tell you much about your grip strength or what the strength is of your muscles. So what I recommend is doing a grip strength test with your fingers curled in onto the scale and squeezing it as far as you can, both sides. And so for me, two hands, about 80 pounds. If I do one hand, I get about 45. It's a good way to kind of see where you're at. It's not been tested over the course of time. As you know, that you may or may not know, the grip strength test was done by a gentleman here in Hawaii that measured grip strength over the course of 40 years. And those measurements are what we use now to determine what normal is. We don't have any long-term studies on grip strength, but the tool that we use for measuring grip strength is the dynamometer. And it's an expensive tool that not a lot of people have access to. And so we're trying to find a easier way for people to understand how much strength they have without having to spend $450 to get a tool to test it. There are some things coming out like the squag, but those, again, haven't been tested over the course of 40 years. So I use this scale. It's cheap. It's easy. If you do the test, send me your numbers. Maybe we can collect some data and find out what normal is and how accurate the test is over the course of time. But it's a good reference. It's a good starting point to measure your grip strength. And again, you want to do it with your fingers curled, not flat. So fingers curled, and see what your grip strength is. All right, let's see. Any questions? Sent a request to be. All right, let's see. Go live. I just asked somebody to join us live, answer any questions that they might have. Sorry, Carpin, maybe you didn't mean to do that. Feel free to join in if you guys want to ask any questions or have me take a look at your wrist. And I think that's all we need to discuss about the Flexor Pollicis Longus Sunday Live TFCC. Come join us. Let's do more on helping people with TFCC tears and educate more about what can be done to heal them, and help people differentiate between TFCC tear versus an ECU sheath tear versus a flexor pollicis longus, stiffness and tightness versus UT tears or triquetrum fractures or hamate fracture, how to differentiate all the different things that cause ulnar-sided wrist pain. And I look forward to hearing from you all and answering your questions. Okay. All right. Have a nice Sunday. I'm waiting for questions and I'm not getting any. So I'm going to end there and I'll see you next week. We'll go over ECU a little bit more depth next week, and send your questions and your thoughts and I will respond